Good morning, everyone. Today we are going to talk about the special tray in prosthodontics, or the special tray. What is the use of special tray, or why, uh, what for it is being used, and what is the importance of a special tray in prosthodontics. So, as we all know, when we classify the type of trays what that are being used for making impression, we can always classify according we can always classify them into stock trays and custom trays. So the stock trays are a prefabricated trays where we get from uh, the market as they've been already made. That means they are not made for any particular condition, or they are not been made for any particular patient as such. But when we come to custom trays, or they can be called as special trays also, they are fabricated on a primary model that we get from primary impressions of the patient, and they have been fabricated for exclusively for that type, for that particular patient itself. That's why they are called as a custom tray or a special tray. So what exactly are these special trays? Special tray is that device which carries, controls, and confines the impression material while making an impression. So we're going to talk about this special tray today. What is the use of special tray, and where it has to be used, and what for what purpose it has to be used, and what is the importance of this special tray. So the ideal requirements for this special tray, that means how they have to be, what are the requisites uh, for a special tray so that it can be used for making an impression. So the type of impression what we're going to make with this special tray, it's known as a secondary impression or a master impression. Okay, so as we all know, uh, what is meant by a prosthesis? A prosthesis is something which which is uh, an artificial replacement for the missing portion, that can be intraorally, that can be extraorally. So both ways, whatever, whenever we are replacing some of the missing parts with anything, that means missing parts with or by means of artificial purpose, that particular thing is known as a prosthesis. So when we have a complete denture patient, when you're replacing all of the teeth for the complete denture patients, so that becomes your complete denture prosthesis. So we're going to have two different types of impressions for complete denture patients. One is a primary impression, and the other one is a secondary impression. The primary impression is the impression what we're going to make with the help of a stock tray. So when we are making an impression with a stock tray for the patient, for a complete denture patient or removable partial denture patient, or for any of the patient, the type of trays what we get from the market, they're not according to the dimensions of the particular maxillary arch or the mandibular arch of the patient. It doesn't suit the patient. So the impression, the preliminary impression, what we're going to make for the patient is with the help of a stock tray. So once we make that preliminary impression, that is a negative likeness for the tissues. So the replica what we get from that patient is known as a positive replica or a mold, uh, or a model. So this secondary, your custom tray or a special tray is fabricated on top of the primary model. That is your positive replica from a primary impression. So once we get that primary model, we are going to make a special tray on top of that, so that we can fabricate a tray, and then which is been accustomed to that particular condition, and the impression material is being carried in this special tray so that we can record the tissues present in the oral cavity better than using a stock tray. That's because we have different types of areas in the oral cavity in maxilla or mandible where we have some stress bearing areas, some relief areas, some support areas. So we always have to see to that the maximum amount of stresses are being received by the support areas and the stress bearing areas. So the particular areas where the stresses have to be relieved, those structures has to be protected. So for this purpose, we need a special tray so that we can carry on we can carry our impression material in the special tray to make a better impression for the healthiness of the tissues in the oral cavity. So what are the ideal requirements for this special tray? It should adapt to the primary cast. It should be dimensionally stable. The tissue surface of the special tray should be free of voids or projections. It should be at least 2 millimeters thick in palatal area and the lingual surface or at the lingual margins of the tray, and at any of the sections it should be thick enough so that it will be rigid when you are working with the special tray. That means it should not bend, it should not distort whenever you are using a special tray for making a secondary impression. And it should not react with the impression material, and it should always be 2 millimeters short of the depth of the sulcus. So all these things are prerequisites for a custom tray or a special tray. And the color of the tray, it should be contrasting so that you can make out where exactly you're putting impression material on the borders so that you can record the depth of the sulcus and the width of the sulcus. Always you should be able to recognize the margin of the tray or the border of the tray so that you can place your tracing compound, that is your green stick compound, which helps you in recording the depth and width of the sulcus. So those are the ideal requirements for custom tray. So what are the different materials what we can use for fabricating this custom trays? One, we can use always uh, autopolymerizing acrylic resins, that's also called as self-cure resins. We have light cure resins. Then we have vacuum formed polyvinyl sheets. Then we have thermoplastic materials. I think we all know what are thermoplastic materials mean. That you have shellac base plates, then you have gatapacha. In olden days, we used to use gatapachas also to fabricate these trays. And thermoplastic resins or thermoplastic material is nothing but your shellac base plate. So how many kinds of these special trays are there, or how exactly do you want to fabricate these special trays for the particular condition, depending upon what we are going to select, or depending upon what material we have we have to select the particular type of resin for the special trays. So that depends on the amount of undercut present in the oral cavity and the type of mucosa present on the ulnar ridges. If you have any hypoplastic tissues or mobile tissues present on ulnar ridges, so we might have to use uh, a different kind of design for the custom tray so that your denture bearing area or of your tissue surface of the denture will not be resting on top of the mobile tissues. Or when you have an undercut present, undercut, I think all of us know what is an undercut means. The area below the height of contour. From third year, I think we all know what is an undercut area. The area below the height of the contour is known as an undercut area. So when you have an undercut area, the impression tray what we have fabricated, that will not be moving into the oral cavity, and it might be difficult for the clinician to place or to remove the special tray into the oral cavity. So these things we have to keep in mind whenever we are fabricating a special tray for that conditions where for the particular patients where they have undercuts, they have to be relieved first or they have to be blocked out first, and then we have to fabricate a special tray according to that condition. So these are the two things we have to keep in mind whenever we are fabricating a special tray for a particular patient. That is, one is the amount of undercut present intraorally and the type of ulnar mucosa on top of the ulnar ridge, whether it is mobile tissue or a firm tissue. Depending upon these things, we have three different types of special tray designs. The first one is a close fitting special tray. The second one is a spaced special tray. And the third one is known as a windowed special tray. So depending upon the condition, we use these three different types of designs of special trays for making a secondary impression for that particular type of condition or situation. So what are this close fitting special trays? These are nothing but where that particular patient is not having any undercut present in the oral cavity. That means there is no problem in seating the special tray in the patient's mouth, and there is no hassle in taking it out. That means you don't have to exert any pressure. The tray, once you place on top of the ulnar ridge or once it is placed intraorally, it just goes in smoothly without any interferences. Okay, so that is a close fitting tray. So what kind of impression materials we have to use for close fitting tray when you're using a close fitting special tray? What kind of impression materials we can use to make secondary impression? So when you have a close fitting tray, it's always advisable to use a non-elastic or rigid impression material, that is typically zinc oxide impression paste. And we can use silicone material also, that is medium bodied silicone material, because it has little more viscosity than a light bodied impression material, and it can hold, and they have the edge strength and the tear strength also is better than light body for a medium body. And every special tray, uh, if you have to carry if you have to carry an impression material in that into the oral cavity, and when you are manipulating the impression so you need something to hold with the fingers, or you need something of the special tray to hold so that the material can be manipulated properly. So that part of the special tray is known as a handle. So there are two kinds of uh, handles which can be fabricated for a special tray. The one handle is intraoral handle, the other one is extraoral handle. For a close fitting tray, we can always use an intraoral handle to hold the special tray. So what is this intraoral handle? So an intraoral handle is a handle which spreads from one premolar area to the other premolar area. That means one buccal frenum to the other buccal frenum, and the height of the handle should be at least at the level of lip. It should be, and this allows the clinician fingers to exert equal amount of pressure on the special tray while making any impression. So next one we're going to talk about is spaced special trays.